This is the MDA machine which I have, and this is the place where the aluminum crystals are filled. This is the place where the dust is collected in this two waste is collected in this. These two are filled with aluminum oxide. This is the aluminum oxide tip which we used. The blasting of the crystals happen from here, and the suction again recollects the crystals back. So here there is the display of the vacuum. These are the wires from which aluminum crystals will come out. Again, this I have an Hydra facial machine, so I have an Hydra facial tip here. The water is collected in this. I fill water in this and it is collected back here, and this is the Hydra tip. Also, one tip I have is for this is the diamond crystal tip. So once we put the mains on, I have to put this machine on, and you will feel the suction here. Okay, so the suction can be adjusted, the intensity can be adjusted by adjusting this knob. The vacuum is already set. Again, the crystal flow and the water flow can be adjusted by this knob. Okay, you are doing the crystal one or you are doing the Hydra one is adjusted accordingly. On the crystal mode itself, this aluminum the diamond crystal tip works, and also the crystal one. But if you do it on the Hydra, only the water tip will start functioning. I'll show you later. So after your patient is lying down, put a napkin and also a headband so that his hair doesn't come in between the procedure. Just make them raise the hair. Put the band and gently push it behind to expose the full head, forehead. Release the ears. After you do that, and patient is comfortable, take a cleansing milk. As I said, no skin treatments is started without cleaning of the face or the skin, or you will spread the bacteria and the dust might cause infection. So with a proper rubbing motion, clean the face. I have already assessed the patient, has got mild comedones. Tray preparation has already been done. We have spirit, retardant, cleansing milk, peel, and a bowl full of water already kept, which is mildly cold water. Once you finish with the cleaning, okay, you wipe the patient, squeeze the sponge and wipe all the cleansing milk. I am using my bare hands for cleaning. For the rest of the procedure, you can use gloves also. So with the towel, tap and clean, dry the face. First I'll start with the diamond tip. Before and after every patient, see that you're disinfecting the tip with a sterlium and a spirit. These tips are adjust it according to the size. So you have a filter here and then the tip here. The filter accumulates all the dirt and you can adjust the size of the tip. One size, okay. So I feel suction here. So the suction is adjusted high to low according to the need of the patient. You just slide it across the face. You're comfortable? The side of the nose usually has the sebum clogged, whiteheads or blackheads. So the nose area is a crucial area to be treated here. There is ample of blackheads and whiteheads. Give a slight pull on the opposite direction so that the skin doesn't get pulled while the suction is pulling away the skin in opposite direction. You see there's mild reddening of this face. Once you finish with this side, you see there's little glossiness here, there's roughness on this face, on this side. Let the patient appreciate the difference. Then start with the other side. Where there's pigmentation, you can give 2 to 3 passes. Usually the direction is from the chin towards the tragus. For the forehead, take it alongside of the eyebrow or pull it upside. Give a pause. Give the pause. You see that the water is coming. The movements are same as that of what you do for if you think the water is coming out more, you can reduce it. So along with the suction, you're also hydrating the peeling. Along with the peeling, you're also hydrating the skin. Usually HydraFacials is done for sensitive and dry skin. So you're not drying up the skin during skin polishing, you're just hydrating the skin also. type of skin polishing, this tip is used and you see a grain of crystals coming out. Now the flow of the crystals is also controlled by you see the skin has become smoother, the comedones have come out. In addition to getting a more deeper effect, you can apply peel also along with it. That will reduce the pigmentation and remove all those acne that are forming. So here I am using because of the oily skin and a lot of comedones, I am using salicylic peel, which is 30%. This will cause mild tingling and burning sensation, so you have to tell the patient in advance that it will cause some amount of tingling. A small quantity is taken in a bowl. And with a fan brush, I start applying in the same motion which I was doing the MDA. The patient is going to experience mild burning and tingling sensation.
कितनी बस की
In cases of where there is like pigmentation,
I don't care. तुम्हें जबरदस्ती
see, you see frosting here, you have to immediately neutralize it. There was frosting, so it must have burnt. So you see with 30% of sali also I got so immediate frosting. So if you are not experienced, go for a very low dilution of peels. You can start with 13% also. So when you see this frosting, you have to immediately neutralize the peel with cold water. The patient was in distress because of the burning sensation. After neutralizing, the burning stops. To cool off the skin, you should give a soothing pack. The frothing has come back to normal after neutralizing. The patient is also relaxed. So just to reduce the burning sensation, we can give a soothing pack to the patient. Make him lie for 5 minutes and then wipe it and can then send the patient with post-operative instructions. Like they are not to remove the peel on their own. It will come back. It will be peeled off on its own. They should avoid sun exposure for at least 72 hours apply moisturizers and soothing gels and to avoid makeup. After the pack dries up, clean the face, apply sunscreen to the patient and let them leave the office.